Hi, I'm Dr. Brent Daigle with the Tift College of Education at Mercer University. Today our topic is emotional behavior disorders. To qualify for special education services, the Individuals with Disabilities Education Improvement Act requires that you exhibit one or more of the following: an inability to learn that can't be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers or teachers, inappropriate types of behavior or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. Multimodal assessment measures are used to determine eligibility for placement into the emotional disturbance category. Both formal and informal diagnostic tools are used to qualify students for this category. Examples of these assessments might include interviews with parents or teachers, use of academic testing, observations in the classroom and also in other social settings like the playground and cafeteria, behavior rating scales, personality inventories, and sometimes projective tests. While correlations between the environment and genetics may exist, there is no known exact cause for emotional and behavior disorders. Factors associated with pregnancy, such as prenatal, perinatal, and postnatal difficulties, may ultimately contribute to emotional and behavior disorders. We also know that genetics can have a profound influence on behavior characteristics. We often see a more direct biological link based on the severity of the emotional disorder. For example, this might include something like schizophrenia. It should be stressed, however, that the precise nature of the biological link remains unclear and there is no evidence that alone is the cause. Some of the characteristics and behaviors seen in children who have emotional disturbance include hyperactivity, aggression, self-injurious behavior, withdrawal or failure to initiate interaction with others, and excessive fear or anxiety around others. Immaturity, and we see this often in the form of inappropriate crying, temper tantrums, poor coping skills. Students in this population often have a very poor self-image, low self-esteem. Students in secondary and high school ages often begin to exhibit illegal behaviors, struggle with serious alcohol and drug addiction, and we see a host of externalizing and internalizing behaviors. We also know that students in this population exhibit a wide range of academic ability. However, most of the individuals in this category are roughly 1 to 2 years below their grade level peers. This population also has a high level of absenteeism and one of the highest groups of students who ultimately drop out of school. We struggle to find a long-term commitment by teachers to work with this population. Unfortunately, the lack of resources, school and district support, the difficulty to compete with events outside of school like drugs, gangs, crime, and the transitional nature of this student group often leads to high amounts of teacher burnout, and these factors combined eventually lead to the critical shortage in this area. We have an ongoing need for teachers who are encouraging, supportive, knowledgeable, and qualified to teach students in this population. I'm Dr. Brent Daigle with the Tift College of Education at Mercer University, and again, thank you for listening.